Hello. So today we're going to be discussing my final project for this master's program. So the main topic of this is tailored education and teach back for the reduction of hospital readmissions. So our project is occurring at St. Joseph Hospital in Bethpage, New York. So this is an acute care hospital on Long Island, New York. It's actually a small community hospital. We only have about 204 inpatient beds. Our emergency room, which can really only accommodate up to 35, but we have had our high census times where we do accommodate up to about 55 before they put us on diversion. And then we also have two outpatient clinics along with an ambulatory surgery center. So, needs assessment. So when we were trying to figure out what would be a good choice for my project, we were trying to see where we fall short exactly. And looking at all the numbers, especially for expenses, it looked like we were spending about almost $3 million each year in just readmission penalties. So we looked through data over like a few months and everything, and it looks like every month it's approximately like 250 to $500,000 that the hospital is paying out in these readmission fees. So we looked back at 3 years of expenses in total. Each year that we've looked at was between $2 to $3 million a year in these expenses, which, if you think about it, that much, we could hire so many more employees. So we really need to cut back on this. So frequent readmission patients were interviewed for data as well. Majority of them admitted they did not fully understand their discharge instructions or their medication administration regimen that they were told at discharge. So this is what we are going to mainly focus on to prevent these readmissions from happening. We want to fully ensure that patients understand what they are to do when they go home and they leave the hospital. So, again, why do we need to reduce readmissions? So, like I said before, it costs the hospital 3 million each year on average. I mean, we're a very small facility, so I'm assuming this number is much higher for those larger facilities. So, Medicare and Medicaid reimbursement is very heavily affected by this. So, Medicare and Medicaid, their reimbursement they have for, like, these core diagnoses, which are acute myocardial infarction, COPD, CHF, pneumonia, total knee arthroplasty, total hip arthroplasty, and also CABG. So, there's this thing called the Hospital Readmissions Reduction Program, the HRRP. So, this is a Medicare value-based purchasing program that is put in place to ensure that hospitals are doing everything possible to ensure that their patients are being discharged with the best and with the resources they need and have been provided the best care possible. So, if these core diagnoses that I just went over, if they're readmitted within 30 days, the reimbursement that the hospital receives from Medicare and Medicaid is in fact compromised. So it really encourages the hospital to do their best with these patients. So goals with readmission reduction. The first thing we want to do, increase hospital profit. We want to increase the profit so we could, one, update our hospital. It's old. We need money so we could fix it. Then we also need staff. We're constantly understaffed, but we don't have the money to hire new staff. So saving $2 to $3 million a year would be huge. We also want to ensure that patients go home with a better understanding of their own care and their own expectations of what they are to do what's normal things for them to feel and when they are supposed to come to the emergency room. We also are going to utilize these funds to improve staffing, which will create better patient outcomes as a whole and also will probably be like a snowball effect of helping to prevent these readmissions in the future. So, tailored education and teach back. So, tailored education and teach back are two really wonderful ways of ensuring that patients understand what is expected of them. So the first thing is tailored education. So this is just education that's customized to the learner. So for instance, if the patient does not know how to read, we are not providing them with paper instructions. We're going to provide them with instructions that are pictures, we'll label different things for them, color codes, stuff like that. Ensure that it's in the correct language for the patient. If the patient needs us to record our voice, we will record the voice on their phone for them, giving them the instructions so they have that reference guide, but we wanna make sure it's the correct education for them. If someone does not read and they speak Spanish, we are not giving them written instructions in English. That is not benefiting them. Then another thing we need to do before the patient physically leaves the building is teach back. Teach back is a technique where the nurse asks the patient to reiterate in their own words what they have just learned. This will ensure that the patient has actually retained stuff and they're not just saying, "Yes, I understand. Yes, yes, yes." This gets rid of that whole question of, did they really get what's going on? So, this program, the anticipated outcome is really a decline in 30-day readmissions. This is the main goal of the entire thing. We do also kind of predict that we're going to have an increase in the average length of stay for these core diagnoses. It might be a day or two longer than currently. Um, but right now the hospital really pushes to get people out rather quickly, which may be non-beneficial at this point considering how many readmissions we have from these diagnoses. So we may really look to keep them a day or two longer to prevent this from happening and make sure they're actually in the best physical condition to leave the hospital. We're also planning on giving rescue kits to these patients. So, like patients with COPD, we're going to give them like inhalers, different drugs, nebulizer treatments to help prevent them from coming to the emergency room. So, these will be resources that they could go to first before they decide, hey, I really don't feel good. I'm going to go to the emergency room. So, how are we going to measure our success with this? So, after we start implementing the modified discharge education for patients, we're going to collect data every month. So, the data is going to include the hospital readmission rates. So, care management and social work will have these handy for us, and they're able to get all that information for us. We are also going to email and mail surveys to patients who were discharged, and those surveys are going to ask questions regarding the discharge process, like if they understood their medications, if they understood their discharge instructions, if they feel like their nurse was rushing them, just so we could get a better feel of the patient's perspective on the whole thing. And lastly, we're going to take a look at the expenses incurred by 30-day readmits and see if that's trending down or not. So for this project, we do have a few stakeholders. So the stakeholders for this project, the main one is the discharging registered nurse. We need to make sure the registered nurses are all on the same page with this program. If they are not going to take the time out of their day to discharge the patient with the proper tailored education or use teach back before they leave. They may rush through it if they're having a bad day, but we need to make sure that the discharging registered nurse understand how important this is. We also need to make sure the physicians who are discharging the patients are on board. We want to make sure they are not discharging their patients prematurely. We also want to make sure they are prescribing them all the correct medications and those rescue kits. Care management is a stakeholder as well because they will be the main ones tracking the readmission rates and ensuring that the nurses are providing education to the patients who have the core diagnoses. Like, for instance, let's say the patient in room 15 has pneumonia. They will send a nice little message to the RN that day and be like, hey, make sure you complete the pneumonia education bundle today. So then, through hospitalization, the patients have constant re education on pneumonia. Nursing ed will also be involved in this. They'll be creating a discharge checklist that the registered nurse is to follow during the process to help guide them. And lastly, nursing leadership, who will be the ones overseeing the entire change. So, how was this project received by stakeholders? So, the registered nurses, they needed some assistance in ensuring they were utilizing teachback correctly. A lot of them really didn't understand what teachback is. They almost Majority of them almost thought it was a return demonstration. Yes, we do want patients who are using things like an inhaler or giving themselves insulin. Yes, we want them to do return demonstrations, but we needed to make sure that the RNs actually knew what teachback was. Once they understood, they were very receptive to it. The physicians, they were willing to explain more to the patient and the family, but they were not willing to go out of their way to go visit the patient at times that were convenient for the patient's family. Care management, they developed the COPD and CHF rescue kits to go home with these high risk readmissions. Nursing ed, as I discussed before, they developed a discharge checklist for the nurse to ensure that all the needs are being met. And then nursing leadership, they are following the data and making adjustments as needed. So, how are we going to sustain these results that we get? So, one, we want to ensure that the discharge checklists are being filled out by the discharging nurses and that all the criteria is, in fact, being met. We want to make the team aware of the improvements that were made and how it's going. We want to tell them if changes need to be made or not, or if they're doing a great job. And if they're doing good, you want to make sure you're celebrating the small wins with the team. If you're not celebrating anything, they're not going to be motivated to keep moving forward with this plan. So, professional goals and A- AONL competencies. So, professional goals with this, um, pretty much it's great knowing that we're able to make such a positive change on these patients' lives and also the hospital from a financial standpoint. So, some of the AONL competencies that are utilizing for this project, the first one is communication and relationship management. This includes the utilization of interprofessional communication between physicians, nurses, and leadership during this discharge education change. Next, we're going to discuss knowledge of the healthcare environment. So, this is very important because this allows the nurse leader to review the current practices that are being done in the hospital. A lot of the times, the nurse leaders are not on the floor, they don't really know what's going on. So, it's very important they know what the current practices are so they can create these revised practices. So we utilize leadership by ensuring that all changes are achievable for the team. We don't want to do anything that's unrealistic because it's not going to happen then. Professionalism, we use this when ensuring that changes are approved by the organization and their standards. And lastly, business skills. We use this when we analyze data regarding readmission rates and expenses in relation. We also prioritize changes that would be most beneficial to the facility. So, what did I learn from this project? I learned that small changes can lead to big results. Just changing the way that you discharge a patient, it's going to save the hospital so much money. It takes a team to achieve any goals. So, this change, although a small change, it cannot happen unless everybody is on board. And lastly, if something doesn't work the first time, modifications can be made. So when we were first discussing this, the first discharge checklist that we made wasn't really that great. So we changed it and the nurses have been following along with it very well now. So that was such a positive change. And pretty much that's everything I have. So thank you for listening.